Wisconsin's Medicaid demonstration waiver asking the feds if we can add work requirements and premiums to Badger Care Plus was approved. We're going to review what was in that waiver request, what the feds had to say about it, and then the likelihood that it might get implemented at all now that there's a change in administration in Wisconsin. But let's refresh our memory first on what this was. It was a Section 1115 demonstration waiver. That's a waiver that's allowed for states to say that they can do the federal Medicaid program differently in their state, kind of get around some of the federal laws because they can improve the health of the state of Wisconsin, or whichever state is submitting it, and do it a little bit differently, improve health outcomes, help everybody in the process, and do a better job. It's flexibility that's given to states in the administration and design of their Medicaid programs. Wisconsin prepared one of these waiver requests. They submitted it back in April of 2017. It went to a public comment period here in the state of Wisconsin. They got a lot of feedback on it. There was over 1,000 people commented. Most were against it. The comments centered on saying, first of all, this is not an appropriate use of a Medicaid waiver. You're not making improvements to the program. In fact, you may be hurting people and cutting them from the program with these requirements. The state had an opportunity to amend the waiver. They didn't do too much tweaking. They went ahead and sent it to the feds. That then opened a second public comment period where people had the opportunity to comment right to the federal government themselves with their concerns or compliments of the waiver request. Again, a substantial number of people commented. The feds then took their time reviewing the request, as they do. And we just got word at the end of October that the federal government mostly approved the waiver request as written. Wisconsin had requested a couple things. First of all, monthly premiums in the Badger Care Plus program for adults without dependent children in the home, frequently called childless adults. So it's a very narrow population of Badger Care Plus that was to be impacted by this premium requirement. They asked for that. They asked for a copay for any use of the emergency room for childless adults. They asked for work requirements of 80 hours per month be instituted. You have to work to keep your Badger Care Plus if you are a childless adult. That was requested. Time-limited Badger Care Plus, if you're not working, if you do not meet the work requirement, they ask that they be allowed to kick people off the program after 48 months of not working, and therefore then be restricted from re-enrolling for a duration of time. They also asked for a health risk assessment, a questionnaire determining likelihood to do safe procedures, live a healthy life, live by good standards, and finally, drug testing. They wanted to institute drug testing similar to what Wisconsin has done in its food assistance program. The federal government responded. They said, first of all, as for charging adults without dependents in the home, those childless adults, as for charging the monthly premiums between 50% and 100% of the FPL for that population of childless adults on Badger Care Plus, that was approved. The penalty for not paying your premium was outlined as disenrollment for 6 months at your annual redetermination. Badger Care Plus has to be renewed each year to determine if you're still eligible. At that redetermination, if it was found that you were not paying your premiums, you could be barred from the program for 6 months. That was approved by the federal government. Emergency room copay, they approved it sort of. They said, well, you said copay for anybody using the emergency room, and they actually pulled that back and said copay only for non-emergent use. Emergency use is okay, non-emergent use is not okay. So copay for people using the emergency room when they should have been using some other physician instead. They said you can't require payment for treatment. You don't have to show you can pay that copay to get the treatment in the emergency room, but it's something that can be charged to that person. So once again, this is a little bit of a blurry definition of making the patient at that moment where they believe they need to go to the emergency room make a self-determination if they think they're going to fit the federal standards of an emergency. So this is what the federal government said in response to that request. When giving their approval, and it was a mostly approval, they said there are a couple things that you can do, and then we're going to make a couple amendments, and there's one thing we're not going to let you do at all. And remember, this was just the conversation between the state and the feds. There has nothing that has been implemented yet. So this is still TBD, but this is just the paperwork going back and forth. The state said, we want to charge premiums for childless adults on Badger Care Plus, and the Fed said, if it's for someone between 50% and 100% of the federal poverty level, that half of the childless adult population, that income that's a little bit on the higher end, and it's still relatively low income, but those are the people you can charge premiums for. They approved that. They then said, you can actually, at redetermination, when someone has to have their annual renewal to determine if they're still eligible for Badgecare Plus, the Fed said at redetermination, if you found they have not been paying their premiums, you can restrict them from Badgecare Plus for the next 6 months. Until their balance is paid in full. If someone pays all their outstanding debt sooner than that, then they won't be restricted for that long. But that's what the condition is as part of the approval. Emergency room copay. The state of Wisconsin had asked that anybody that uses the emergency room pay a copay to do so. Their rationale for that was to try to cut down on unnecessary use of the emergency room. And the Fed said, well, why don't you just say it that way? That non-emergent use of the emergency room, those people will have to pay a copay. But emergency use of the emergency room will not, with the idea that nobody can be turned away from the emergency room, but copays might be assigned later to those people that where it was determined it was a non-emergent use. Now, that's not always the best health advice, is to make someone stand and determine if their case would fit the definition of the state's definition of an emergency. We want to encourage people to get the health care when they need it. But this was an opportunity for the feds and the state to agree that they want to make sure that people are using the emergency room only in cases of emergency. They then took a look at that work requirement, and this is the one that's been getting the most attention because other states have tried this, and it's been caught up in litigation in at least 2 states thus far. Wisconsin copied a lot of the language from states like Kentucky and Arkansas, states that are now in litigation over their work requirement in the Medicaid program. And Wisconsin said, we want our childless adults on Badgecare Plus to work 80 hours a month, and the feds approved that. Wisconsin is the first state that does not have a Medicaid expansion approved, that federal Medicaid expansion. Wisconsin does not have that, but we're the first state to ask for work requirements. All the other states that have work requirements have Medicaid expansion. So this is a first for Wisconsin. It is seen, and most of the comments that came in said this is going to be damaging. You can't condition Medicaid on work. Now, the Fed said, not working starts that time-limited clock. And they approved time-limited Badgecare Plus as well. If you're not working for up to 48 months, then you're going to be kicked off your Badgecare Plus. So you have to work 80 hours a month, and if you don't work, then that starts the clock ticking to determine if you're going to be kicked off your Badgecare Plus after 48 months. If not working after 48 months, you can be disenrolled, and you can be restrictively re-enrolled, which means barred from the program for the next 6 months. Let's go on to the health risk assessment. That was approved by the feds the way it was written, and the feds went ahead and expanded that to what they thought they would like to see. They required an application. If you're going to sign up for Badgecare Plus at the first time, you're going to have to take the health risk assessment. If you don't, you will not be eligible for Badgecare Plus. You have to comply with the health risk assessment or no Badgecare Plus for you. This is at approval for the initial application. It is also at renewal. Every time you renew your Badgecare Plus, which is annually, you will have to answer this assessment or be kicked off of the program entirely. They will ask drug abuse questions. And this is interesting because if you are reading ahead, you will see that drug testing was rejected by the feds. The state of Wisconsin wanted to drug test people to determine eligibility for Badgecare Plus, and the feds said you can't do that. That has been found to be unconstitutional in other states. Florida is our prime example for that. But they still said, the feds still said, but you can go ahead and ask the similar questions that you would have asked in drug testing. You can ask them during your health risk assessment. So that has been expanded, and that was approved by the feds. Now, other changes that were added that didn't get as much attention, but one of these actually is positive. The state asked to eliminate premiums for their transitional Medicaid program. The way that's evolved over the years has been into what's called the Badgecare Plus extension. When someone is eligible for Badgecare Plus and then their income increases slightly, when that happens, they may be eligible to extend their Badgecare into the future and pay a premium for it to kind of help offset the cost. Well, the way that this new rule is approved by the feds has turned out is to say you can keep your Badgecare Plus extensions, but you no longer will be charging premiums for those people. So that was approved by the feds. Now, the last part of the waiver that we're going to mention here that was approved was to cover residential substance use disorder treatment for all Badgecare Plus and Medicaid enrollees, and that was approved, but the state does have to get back to the feds on that, on how they're going to do that. That then raises bigger questions about what that looks like. If people can use Medicaid or Badgecare Plus for substance use disorder treatment, how are they going to find a treatment facility that accepts Badger Care Plus? So that's a double-edged sword there. It is seen as a positive thing, and there is hope that the state can come up with a plan that will impact a lot of people in the state of Wisconsin. Like we said, Wisconsin is the 4th state, more or less, to get work requirements in its Medicaid program approved. Indiana, Arkansas, New Hampshire were the other states, and then Kentucky with an asterisk. Kentucky's entire work requirement was invalidated in the courts. Arkansas, that lawsuit is still in progress because they are losing thousands of people who are otherwise eligible for Medicaid in the state of Arkansas but can't prove the work requirement. Even though many of them are working, they can't do that online verification. So thousands of people have been losing their Medicaid, and there are legal challenges to that at the moment. Like we said, Wisconsin is the first state without Medicaid expansion to get approval for work requirements. So we're new territory here. It's also the first state to get approval to terminate Medicaid for people who are low income that aren't paying their monthly premium. So that's new territory as well and could be subject to legal challenges. Let's talk about what's next, because there's a lot of stuff. Like we said, this is the conversation between the states and the feds right now. Nothing has been implemented with the exception of an anticipated start date for getting rid of those premiums for those transitional Medicaid patients. That one little asterisk that was right toward the end of what was approved in the waiver. That's the one thing that appears to be moving forward faster than anything else. But as for work requirements, as for premiums, as for the ER copay, nothing has been established yet with an implementation date. And here's why. First of all, some of the elements, like we mentioned, the state has to get back to the feds with a plan of how they're going to make it work. They have to get an implementation plan together. They have either 60 or 90 days in some instances to get some of their homework done and show it to the feds. The original timeline for implementation could be as early as spring of 2019, but between now, or when this waiver was approved on Halloween, moving forward, Wisconsin had an election and the administration changed. We have a new governor in the state of Wisconsin, different political party, not in favor of these work requirements and premiums and Badger Care Plus. Now, there is conversation, and health policy experts are speculating that the new governor could potentially withdraw or amend or simply not implement this waiver. So he could pick and choose out of this waiver and say, potentially, let's get rid of those premiums for the transitional Medicaid patients, as the ball's already rolling on that, but let's not institute work requirements, because essentially a Section 1115 demonstration waiver is a demonstration. It's an experiment to say we think our Medicaid program can work better with these changes. Well, it's not an experiment if we already have results from other states that say this doesn't work. Our results from Kentucky and Arkansas show us that work requirements don't work. Wisconsin could take that advice and say we're not going to do it here. So we are still looking, as the administration changes, to see what the plan for the new governor will be with implementing any or all of these changes or withdrawing the waiver altogether. Here's a little homework you can do. You can read up on that approval letter coming in from Seema Verma, from the Centers for Medicare and Medicaid Services. You can also read the new Kaiser Family Foundation brief that goes into a little bit more detail about the midterm elections and how that has changed some of the states and some of their demonstration waiver requests and what that might mean for the future of some of the Medicaid programs. An interesting read. If you have questions or want to send us an email, you can visit us at healthwatchwisconsin.org.